today is the most concerning day of the pandemic that we've seen in New South Wales. I certainly will not be detracting from that strong message. We had 130,000 tests overnight, and very concerningly, we had 466 cases of community transmission. This is the largest jump we have seen in a night, and it's fair to say that we are on a par of being extremely concerned about the situation that we're in New South Wales. At least 60 of those were infectious in the community, but that number is likely to go up given a number of cases are still under investigation. Unfortunately, we had 4 deaths overnight, and we extend our deepest condolences to each and every one of the family and loved ones. As I say every day, we read out the statistics, but behind each statistic is a human being with loved ones they've left behind, and our heart goes out to all of them in these tragic circumstances. We had a female in her 40s who was in palliative care. She wasn't vaccinated at Concord Hospital who passed away. A male in his 70s, he was vaccinated but did have pre-existing conditions who died at Liverpool Hospital. A male in his 80s who died at Concord Hospital who wasn't vaccinated, and a female in her 70s at Campbelltown Hospital, but we've yet to get further details as her death was only reported very recently, and we'll be able to provide further updates as they come to hand. As I said the last few days, we are seeing stabilisation in the Fairfield and Canterbury-Bankstown local government areas with ongoing decline in growth of cases. And pleasingly, those 2 local government areas have gone from low levels of vaccination to at least 40% of first doses, which contributes to the concerted targeted approach we've had in those local government areas. But the main suburbs of concern in and around Western Sydney and southwestern Sydney are, and I really want people in these communities to take heed, Blacktown, Doonside, Mount Druitt, Merrylands, Guildford and Auburn, where we're seeing the largest areas of growth. In regional New South Wales, concerningly, Western New South Wales, so Dubbo and the surrounding communities, has seen 26 cases overnight. And it is likely that health advice today will ask us to extend the local government areas in lockdown. Most of far western New South Wales is already in that situation, but there were a couple of local government areas outstanding, and I suspect we'll be getting that advice later today. Hunter, New England had 16 cases overnight. Armidale, Tamworth and Northern Rivers still remain at 0 cases, but obviously Health is watching those circumstances, and whilst Armidale still has 0 cases after a week, Health has recommended that lockdown be extended for a further 7 days to make sure that there aren't any undetected cases, given the information Health received has changed from those concerned in the first few days of being detected as positive. So whilst those 3 areas have had 0 cases, Armidale, the community of Armidale will be asked to stay in lockdown for at least the next week. Can I say on a positive note that New South Wales has pretty much reached 50% of first doses vaccinated. We know that the lockdown coupled with a strong targeted vaccination program is what is going to get us out of this dire situation. Vaccination is key. Don't wait. Please come forward and get vaccinated. Pleasingly, tomorrow we have around 10,000 tradies and construction workers in those local government areas of concern in Greater Sydney who are getting the vaccine. And during next week, 100,000 authorised workers in those local government areas of concern will be getting vaccinated. And we know that not only will that keep themselves safe and their families, but it will help reduce the spread, because people in certain jobs have to work and they may not have symptoms, but they may have the virus. This is the nature of Delta. It is something we haven't seen before and is spreading in a way we've not seen before. And if we want to stop the spread, we need to get people vaccinated. So thank you to those who've come forward. Please continue to do so, and don't wait for one or other vaccine. Please come forward and get vaccinated. I also want to provide an update regarding the activities of the New South Wales Police. As we stated publicly this week, Commissioner Fuller, the Minister, myself and our team have been in contact about what police need in relation to escalating their compliance efforts to make sure that the whole of government response in relation to compliance is done as adequately as possible across the state. And of course, we note that it only takes a handful of people to do the wrong thing, and I know that the vast majority of people are doing the right thing, and that's a positive. We know that in some of these local government areas of concern, the streets are bare, people are staying home and doing the right thing, but it literally only takes a handful of people to do the wrong thing, to have a super spreading event, an unauthorised gathering, and we have a major setback. And that's why it's so critical for the police to be given these additional resources. And I want to thank Commissioner Fuller and Minister Elliott for their direct involvement in this process. There's two categories of changes in relation to policing that I want to briefly mention before Dr McAnulty will give the health update and Police Commissioner Fuller will then also make comment. Firstly, in relation to police operations, there will be a visible and increased police presence in the affected local government areas, including deployment of specialised commands and including a riot squad, highway patrol and increased presence more broadly. From Monday, there'll be 500 extra Australian Defence officers on the ground as well, following a request by New South Wales Police. There'll be enhanced random checkpoints at key roads with accompanying electronic warning signs so that police have every ability with that increased presence to clamp down on people doing the wrong thing. From Monday, the health orders will be formally enforced from midnight. However, between now and then, police will still be able to impose these additional fines, even though the health orders kick in on Monday morning after midnight. Between now and then, if police have evidence that you're doing the wrong thing in any of these categories, these additional fines will apply. So $5,000 for on-the-spot breach of home quarantine, which is currently $1,000. $5,000 on the spot for lying on a permit, which is already a criminal offence. $5,000 on the spot fine for lying to a contact tracer, which is already a criminal offence. $3,000 on the spot fine for breaching the two-person exercise rule in any way. $3,000 on the spot fine for breaching rules going into regional New South Wales. In Greater Sydney and other lockdown areas, but not the local government areas of concern, the 10-kilometre rule will come down to 5 kilometres. So you can obviously do activity within your local government area, but instead of 10 kilometres from your home, it will be 5 kilometres from your home, and that's for all of Greater Sydney. All those areas which aren't the local government areas of concern will now have imposed on them the 5 kilometres instead of the 10 kilometres. In affected local government areas, we want to stress that exercise means only exercise and supervision of children. So the word recreation will not leave any doubt that word is taken out in terms of those local government areas of concern. Exercise means exercise. Many people know that, but unfortunately some people were trying to get around the rules that were imposed. In affected local government areas, you will need to register your single buddy to make sure that people aren't abusing that rule. And also, importantly, for regional New South Wales, you will need a permit to go into regional New South Wales, whether you're an authorised worker, whether you're travelling to a second home because you might be a worker utilising a second home, or whether you're inspecting real estate. You will need a permit. The permit system will be effective from next Saturday, but obviously between now and then, police can stop you and seek evidence for what you're doing, and if you're doing the wrong thing, you'll have those extra fines imposed. Obviously, we've also tightened the rule, as was foreshadowed, around inspection of real estate property and others where it's limited to one person, and only one person, of course, can travel to a second home. So these are additional resources and additional penalties and tightening of orders in some circumstances to provide police all the resources they need to be able to ensure that compliance is maintained at all times and to ensure that the small handful of people doing the wrong thing are prevented from doing the wrong thing. I'll now ask Dr McAnulty to provide his health update, and then Commissioner Fuller will talk about the increased police presence and the police operations, and then of course we'll take any questions. Thank you.
Thanks, Premier, and good morning, everyone. Just give you an update of the numbers overnight. As the Premier said, we've seen a very concerning upswing in numbers for yesterday, with 466 locally acquired cases of COVID-19 reported to 8 o'clock last night. There was one overseas acquired case in the same period. We had outstanding testing results, however, with 129,352 tests reported to 8 o'clock last night. By isolation status of the 466 locally acquired cases, 76 were in isolation throughout their infectious period, 19 for part of their infectious period, and at least 68 were infectious in the community. In terms of hospitalisations, we currently have 378 patients with COVID in hospital, 64 are in intensive care, and 29 require ventilation. And again, we're seeing a range of ages, including relatively young people in intensive care. 4 are in their 20s, 6 are in their 30s, and 7 are in their 40s. We have seen an increase in sewage detection in concerning areas of the state, Broken Hill and Ballina and Brooklyn, just north of Sydney. So we're urging people who live in those areas where we don't have identified cases to please monitor very closely for symptoms and come forward for testing at even the slightest of symptoms, so we can find if there are cases in the community who are contributing to these positive sewage findings. So please come forward for testing, help us find and control any further spread in those communities. In Western New South Wales, we're still seeing cases emerge in the outbreak that's affecting primarily Dubbo and Walgett. Public health units are working very hard there to identify cases, work with the community to make sure that people are tested and identified should they be cases. Please come forward for testing. We know that some people wait some days with symptoms before they go and get a test. It's really, really important. Assume it's COVID until proven otherwise. Go and get a test at one of the many clinics around the state if you have any of the mildest of symptoms. Thanks very much.
Good morning, ladies and gents. Thank you, Premier. Thanks, Minister. The New South Wales Police Force will launch Operation Stay at Home Sunday at midnight. New South Wales Police will be supported by the Australian Defence Force. As you know, there are already 300 men and women of the ADF on the ground, and an additional 500 will come online from Monday. During the week, the Police Minister and I approached the Premier about some enhancements to the health order, and most of those were requests that came from the field, the police in the field, who were having difficulties getting compliance from some members of the community. The movement, particularly in Greater Sydney, was way too high from our perspective in terms of what we were trying to achieve. And our part in this is to get New South Wales Health ahead of the Delta variants. The fines are some of the biggest fines that I've ever seen, and we will be issuing them as of today. So can I say to the members of the community out there is that you may think that leaving your LGA to train is okay, but it's not. You've got a 5K limit now from your house in Greater Metro Sydney. We will be enforcing that. You do have to carry identification. There's a whole range of other health orders that we can use against you. I closed the first business this morning, a cafeteria at Leichhardt, for 14 days for continual breaches of the health order, and I won't apologise that more businesses will be closed over the next 21 days. The permit system is essential in terms of protecting regional New South Wales, and I would ask from Monday there will be information online on the government website in terms of how to access a permit, and the permit system will come in place midnight Friday next week. I think it's important that those people who have been getting around the orders, taking family vacations to other premises, that is over. The permit will only allow generally one person to travel for what is essential business. Premier spoke about the assets that will be involved in this operation. There are 1,400 men and women in the New South Wales Highway Patrol who now will be dedicated to COVID compliance duties on our roads. You would have seen roadblocks both south and north over the last couple of days, and across Greater Sydney and into regional New South Wales. Expect to see more roadblocks where we'll be checking with compliance. Some of the strongest laws, some of the strongest police action coming. I'm not apologetic. Please don't write and complain to me. We've given ample warnings and cautions. That time has gone. Thank you.